Hello, I'm Liz Miles, a GP and Clinical Director for Primary Care with the Australian Commission on Safety and Quality in Healthcare. I'm here to tell you about two new resources that the Commission is releasing. A new interactive women's health focus report with national trend data and the revised heavy menstrual bleeding clinical care standard. This work is incredibly important because we know that 1 in 4 women have heavy periods that can seriously affect their quality of life. And yet there can still be shame and stigma in talking about menstruation, so it's an issue that's hidden by many women. Heavy menstrual bleeding continues to be under-recognised, with about half of all women who have the condition not seeking medical care. And this is often because women don't know that their period is not normal, or they don't feel comfortable talking about it with a health professional. So why did we develop the Heavy Menstrual Bleeding Clinical Care Standard? The standard was first developed in 2017 because of concerning findings by the Commission about hysterectomy rates in Australia. Rates were high by international standards, and around the country there were significant differences in hysterectomy rates based on where women lived. Hysterectomy is an effective treatment option for heavy menstrual bleeding, but it's a major operation, it's not reversible, and it comes with a number of risks. It's essential that women have access to less invasive alternatives, regardless of where they live. And that's why the standard was introduced. It aims to improve the range of treatments available to women with heavy menstrual bleeding and provides clinicians with guidance on how they can support their patients. By ensuring that women know the options available for their situation, we are enabling them to make informed choices about their care. The new Women's Health Focus Report examines trends in hysterectomy rates since this work began a decade ago in 2014. It's really encouraging to see that by 2022, the rate had fallen by 20% nationally. For endometrial ablation, one of the less invasive alternatives to hysterectomy, the rate had increased by 10% within a similar period. And while we can see some improvement since the clinical care standard was first introduced, there is more work to do. Hysterectomy rates remain high compared with similar countries like New Zealand and the UK, and there is still considerable variation across Australia. Both hysterectomy and endometrial ablation rates are higher in regional Australia than in major cities and remote areas. And the hysterectomy rate for First Nations women was 9% higher than for other Australian women in 2021-22. So this map shows hysterectomy rates across Australia in the most recent reporting period. Local areas with higher rates of hysterectomy are shown in the darker blue colours, and those with lower rates are in the lighter colours. I'd really like to encourage you to look at the interactive maps and graphs in the Women's Health Focus Report on the Commission's website. You can drill down and see how your state or territory, your primary health network, and your local area compares. There's a wealth of information in this report. Mapping geographical variation in this way is a powerful tool. It can help us look into the appropriateness of care and allow us to plan for improvement where warranted. Of course, one of the key resources that can help us respond to variation in care is the Heavy Menstrual Bleeding Clinical Care Standard. The standard contains 8 quality statements describing best practice care. It provides targeted information for women, clinicians and healthcare services. I'd urge you all to look at the standard, but there are a few key areas I'd like to highlight. Firstly, it's important to ask women about their menstrual health and the impact of heavy menstrual bleeding on their quality of life as part of a comprehensive assessment. Secondly, we want to offer women treatment options that are tailored to suit their individual needs and preferences, starting with less invasive options, including medical management with oral medicines or the hormonal IUD. And finally, when women have made informed decisions about their care and they understand the risks and benefits, let's make sure our systems support them to access their preferred treatments wherever they are in Australia. I encourage you to go to the Commission's website to find out more about the Clinical Care Standard. With the release of these new women's health resources, we want to let women know that they don't need to put up with heavy menstrual bleeding that is seriously impacting their life. We also want clinicians and healthcare services to look at their local area data and consider what more they can do. There is so much that can be done to help women with heavy menstrual bleeding improve their quality of life. Thank you for helping us to make a real difference to the lives of these women. Please take the time to find out more on the Commission's website.